SurgeonsDoctors of Reddit, what's the dumbest thing patients have lied about? Not a doctor, but in patient care nonetheless. Guy comes in between 17-19 years old for a pebble hits penis. Pretty odd. He says he was doing yard work when the tool knocked a pebble into his penis. He went to check it, and now it was making pus. Nurse clarified that he was wearing pants. Denies sexual history. He stands by that he got hit on his penis by a rock through his pants that made him produce pus. He had chlamydia. Guy says he was forced to do meth or something similar at a store. Came in because he thought he was dying. A fun bonus. A frequent flyer comes in for his stomach hurting from eating this chili he had, while continuing to eat said chili in the lobby. Edit. I have a few funny other stories that I'm just going to add to the fun of it. Woman comes in after doing crack and states. Now she feels sad. That's all we got. Older woman who, odd on something, says she thinks her son poisoned her who she hasn't had contact with in years. Old man with various infections, but his pubic hair was green. We still do not know why. Guy came in for vomiting on Thanksgiving because he ate too much, but it was really tasty. No other complaints and felt fine now. Addict left a meth right now. Addict left Aimer because he had to go to meth right now. He was in for other issues, but had to leave immediately to do more methy. He eventually came back for treatment, thankfully. Minor comes in for poisoning. Turns out she had food in the microwave, sprayed said food and microwave with roach poisoning, then ate said food and vomited. Now comes into her on Thursday. Events happened Sunday because she was having contractions. Edit for clarity, lol. She was also 27 weeks pregnant and eating roach poisoning. That last one. I had a kid doing theatre in a show I just directed who presented a super one show. Sweaty, pale, can't stay out of the bathroom. Classic stomach bug, and there had been one going around. He looks at me while we're waiting for his mother to arrive to take him home and says, "Uck, this always happens when I eat chili." Wait, this has happened before. Yeah, like once a week when we have chili. Kid and his mom knew full well he got sick every time he ate chili, but never considered not eating chili. I can't even. Woman comes to emerge with complaints of vaginal discharge and discomfort. Pelvic exam initially reveals significant yeast infection, but there appears to be a foreign body in her vagina. Is there something stuck inside? No, I don't know what's in there. Speculum examination reveals a very soft mandarin orange, peel still on. Oh, that. We heard it would improve our fertility. You can't make this shit up. No, I don't know what's in there. Oh, that. Could they be talking about the mandarin orange? Nah, they're probably used to those. Any foreign objects? Oh no, it's locally grown. Do you have any medical problems? No, so, no diabetes? No diabetes, what medications are you taking? Metformin. For my diabetes, I facepalm every time. There's a former nurse in TikTok that does skits about his former career, and he recently did one where patient was adamant he didn't have any problems with his blood pressure because he takes his blood pressure pill all the fucking time. Sir, do you have any heart trouble? No. What medications do you take? Lists 3 different cardiac meds, so you do have heart trouble. Looks at us like we're dumb. No, I take meds for it. I once had a nurse think I was lying about diabetes. I had a nerve pain thing in my foot, and I'm also overweight. The convo went like this as we were going over what medication I was on. So, how long have you had diabetes? I don't have diabetes. You said you're taking gabapentin. It's for the nerve pain in my foot from tarsal tunnel. Then she gave me this look that was just short of rolling her eyes. I was like, don't know what to tell you, lady. I mean, why would she automatically think gabapentin, of all things, is diabetes? It is prescribed for all manner of things. I had a guy insist that someone else put cocaine and heroin in his urine. Even after I tried to move on with the conversation, had someone say that their roommate used a spoon when cooking meth, and then he ate cereal with that spoon later, and that's why his piss popped hot for amphetamine. We have a favorite story about a colleague who failed a random drug test. Turns out he was at a party where other people were doing drugs. Not him, but he put his sandwich down on a table at one point. Adherence to medical treatment when I have literally pulled their pharmacy records and know they haven't picked up their medications in over a year. Guy came in for a wound on his lower leg that he said came from a biking accident. X-ray revealed a bullet inside his ankle joint. The wound was from shooting himself by accident while holding a gun. Still don't know how he didn't fracture anything. If I had a bullet in my ankle, I'd probably wreck on my bike also. Lol. Reminds me of an older Englishman I met at a bar in Thailand. He had an exterior rod with pins sticking out of his leg and was on crutches. We started talking and I asked him how he did the it. He said the short answer was that he wrecked his motorcycle. I asked what the long story was. He said, I came home and my Thai girlfriend accused me of cheating on her. She came at me with a kitchen knife and slashed my arms several times before I could run out of the house. I hopped on my motorbike and made it a kilometer down the road before passing out from blood loss. Woke up in a hospital with a shattered leg and several blood transfusions. The fact that he didn't say, my Thai ex-girlfriend, concerns me a bit. Meth used prior to surgery, he did not survive. Part of my job is dealing with medical records. My favorite part is when you are reading the doctor's notes and you can tell they are fed up with the patient's bullshit from their tone. Patient in for routine colonoscopy. Asked if solids consumed in 24 hours prior. Patient confirms no. In process of procedure, several dozen kernels of corn are discovered in colon and cannot continue. Patient specifically instructed not to consume corn beforehand, as this happened prior visit. As a former public defender where my clients lie all the time, and I have to restrain from being an ass in my notes, I can relate. Edit. Lie to me. Hell, I get it as a software consultant. Me. Did you do this change? Client. New me. Pulls up audit log. Them. I rebooted it me. C's uptime is weeks. Ooh, ha. I restarted my computer, see. Power cycles the monitor. I also enjoyed reading medical records in which some info was almost certainly only included because it was amusing. For example, some psych patients were very creative and descriptive when insulting the medical staff. One intake evaluation included a line saying something like, Pete stated that Dr. XX looks like a gothic scoundrel. Another was simply like, Pete T claims to have made love to Dr. XX's wife. This patient is well known to our service. My favorite note I've written was patient stated, fuck you, fat ass, when I refused to let him get out of bed hours after falling and cracking his head open. Colonoscopy prep is so brutal that I don't understand why anyone would actually purposely not follow the guidelines and risk having to do it all again. Had my first one recently, and while it wasn't as bad as I had expected, when the doctor told me things looked great and I could wait another 10 years before the next one, I nearly hugged him. I love reading between the lines of other physicians' notes and picking up on the sass. It is one of the delights of my day. One dude lied about being paralyzed after a lumbar puncture. Get a call from nurse patient says he can't move legs following a lumbar puncture. Sinal tap. I called the team that did the procedure and they assured me there was no indication of this sort of injury happening during the procedure, but agreed with my plan to get an urgent MRI. I go to examine him and nurse says she thinks he moved one of his feet. Next thing I know, he says he can actually move his legs again, but they are feeling weird. Then this weird feeling turns into intense pain and he asks for intravenous narcotics. Dear Laude, I tell him no, because this story makes no sense. By God, it was a miracle, I tell you, when this man walked himself right out of the hospital after I refused the IV narcotics. Also, the MRI was normal. Patient, I haven't drank alcohol in months. Patient's family, it's true I've been with her the whole time.
Me, Mum, your alcohol level is 325. Patient, impossible. I would never lie to you.
My instructor shared a story once of a patient that kept insisting she never drank alcohol. It turned out she didn't consider wine to be alcohol because it was served in church. Only distilled spirits and beer were alcohol, so her 2 bottles of wine a day didn't count. Know of someone who had their entire family lie about having stopped drinking. Imagine the transplant team's surprise when he went through DUTS while in the recovery room post-op. Did cocaine the night before elective surgery, didn't disclose at pre-op cardiac arrest. Beta blockers and cocaine don't mix well. Oh my God. There's a reason that do not give beta blockers for a cocaine overdose is in bold in med school textbooks. For those curious, you have alpha and beta receptors to help vasoconstrict and raise blood pressure. Blocking the beta receptors with a beta blocker lowers blood pressure in most people, except cocaine stimulates alpha and beta receptors at the same time. If you block just one, the other one keeps on going, and it can make blood pressure go dangerously high and cause a heart attack or stroke. One of my favorite things I wrote my first year out of medical school. Please note patient has stated multiple times that he wants to leave and would leave against medical advice. He asked multiple times whether he could eat and stating he is hungry. Explained to patient that we would like to start a full liquid diet first, and if he tolerated it well, would transition to regular foods. However, Pete ordered Chinese food delivery instead. Then patient was complaining of a headache. Was given Tylenol for the headache. Patient stated that this did not help him. His sister at bedside went to the nearby pharmacy and bought goody powder, aspirin. Sister did ask whether she could give him goody powder. She was told not to give patient the goody powder. She supposedly did not. For context, the patient had a catastrophic ghee bleed from taking too much aspirin. Catastrophic is one of those descriptive words you just don't want to hear in a medical setting. Do you smoke cigarettes? No, I quit. When did you quit? This morning. Quitting's easy. I've done it 1,000 times. It's not so much a patient lie as it is me being dumb, inexperienced and uncomfortable, asking necessary questions. I had a hypothetical patient during residency that was a very manly veteran, and I was admitting him for rectal bleeding. He was in the age where it more than likely colon cancer, so I didn't think it was necessary to ask a sexual history. Folks at this particular establishment were known to at times be homophobic, and I had been yelled at by patients previously for asking, do you have sex with men, women, or both? It ate away at my conscience, though, so I went back in absurdly nervously and asked him. He answered, son, I'm as gay as a rainbow. I've been at the bathhouse for the last couple of nights, but I wasn't sure how it would go over to admit it. That's when the bleeding started. It was a very important lesson for me. I had a lady tell me she had no idea how she got a rash she had on her face. I left the room, gave report to the maid, and when I walked back in with the doctor, she looked at me and said, I didn't think you'd be coming back in the room, and then proceeded to confess that she'd been cheating on her husband and thought she had herpes. She did not have herpes. If it makes you feel better, patients do this kind of stuff to M's all the time, and the newer triage nurses must think they're all bad at their jobs. It happens to veterinary staff too. We put the patient and client in a room, get some history with very specific questions, any vomiting or diarrhea. Nope, and the vet goes in, and they say, ugh, Fluffy has had explosive shits for a week, like. This must just be the standard for any medical practice. I'm an ophthalmic tech. At least once a day, I ask a patient if they've noticed any new vision changes over the last year, and they answer no. Everything about the same, and my glasses are still working well. No concerns at all. Then when I bring the doctor in and come in with him, all of a sudden they have a laundry list of issues. Drives me crazy. My little brother was a nurse for about a decade. He has said many times that people stick anything up their butts. From light bulbs to hairbrush to a golf shoe, and at first it's hilarious. Then after a year or so it's not funny, because you've seen way too many distended butt though. Then after a decade or so, it starts to get funny again, because you think you've seen everything, and then one day a 45-year-old man is driven to the hospital by his wife, and he has a golf shoe up his ass. And he told his wife that he and the boys were golfing, and he slipped in the locker room, and he slipped in the locker room, and he got rammed up there, completely disregarding the fact that the part of the shoe that is inside him is covered in Vaseline. Wait, don't golf shoes have spikes? Ribbed for his pleasure. Yes. It's only gay if it's a sex toy. Shoes are fine. These men. Penis modification. The case was an elective above the waist surgery, and he denied piercings. However, when the nurse went to place the Foley, she found the patient had modified his penis, and it was spitrificated with multiple piercings to look like a cobra. The nurse did not know how to insert the Foley. The piercings also limited the ability to use electrocautery. In addition, he also embedded a metal implant inside his testicle that looked infected with a possible upset. Cancelled case called Urology Consult for Infection Obsess Evaluation. I hate just about every word in this paragraph. I'm laughing out loud imagining the encounter. Okay, now a Foley. Just a quick. Is that fucking cobra dick? Did that really need to be literal poetry as well as figurative? Yes, I think it did. I had ear surgery and asked if my below-the-belt piercings needed to be removed. They explained that electrocauterize thing and asked, "Do you want to take that chance?" Same with an MRI. This reminded me of that episode of Hassund, where they had a patient who was a stage magician go through the MRI, only to be screaming in pain because he forgot he had swallowed one of those keys for handcuffs, and it almost ripped out through his intestine. There was also the EP, where a coma patient, I think, had a bullet in some part of him. House insisted on doing the MRI anyway, and it ripped out of the patient and destroyed the machine edit. Oh, I get it. It was a corpse, not a patient, and in reality, it probably wouldn't have happened like that. It's a fictional TV show that I haven't watched in years. Calm down. A common one is about their smoking. Smoking is an enormous risk factor for fracture non-union, meaning a fracture that doesn't heal. When I walk into a non-union patient's exam room and it smells like a cigar den, I know they smoke. But they'll tell me they don't write to my face. Before signing them up for revision surgery, I'll commonly order a urine test for nicotine metabolites. Often it'll turn out positive and suddenly surprised, Pikachu face. Edit. Lots of folks below rightfully commenting on how indicating you're a smoker increases your insurance premiums. This is true. However, the cost of complications after a surgical procedure would dwarf a lifetime of increased premium costs. I would still recommend that smokers be straight with their surgeons so they don't rush into surgeries that end poorly. I'm a hygienist, and people try to tell me they don't smoke. When my dad stopped smoking, his dentist gave home a gift certificate for a nice restaurant. Said it made his job so much easier. They were friends too. Their identity. Insurance fraud using a friend's relative's insurance card. As a resident in a very large East Coast hospital, I was tasked to figure things out when the blood bank called and said their blood type changed. When confronted with getting the wrong blood that may kill them, they almost always tell the truth. This type of fraud has also resulted in people who have been dead and autopsied, raising from the dead and appearing in a clinic or I had a patient that lied about having a job. I asked because he had hepatitis A, and I wanted to know if he needed a medical leave. He denied it even though I asked twice. Next day, he came back because he was going to get fired if he didn't provide a doctor's note. Some clarification. I'm in Venezuela. He wouldn't have had to pay anything for that visit, regardless of his employment status. He isn't an undocumented immigrant. It's a very small community where everyone knows each other, and he has lived there his whole life, and many of his relatives have also been my patient. Also, undocumented immigrants aren't really a thing here. Some tourists may come without having the proper paperwork, but this isn't really a desirable place for immigrants looking for work. He said that he didn't have a job. He didn't say that he didn't need a medical. I asked what he did for work in his second visit, but I can't remember what he told me. There really isn't a whole lot of stigma around happy around here, even if you work handling food. People just sort of feel sorry for the person and tell them to not eat yellow thing. So I don't think it was because he was afraid of being shame-reprimanded because of it, but I could be wrong. I'm obligated to report viral hepatitis cases to the health ministry, so they make sure there isn't an outbreak, and I told him this. So he knew that it was going to be reported either way. That is actually stranger than the IV drug users, or the amazing variety of objects crammed where the sun don't shine. Those sort of make sense. Lying about having a job is perplexing. Patient says to me, I was outside gardening while naked and I slipped. That's how a massive potato ended up in my ass. Anybody want fries while he is waiting to get it removed? How did you get that stab wound in your abdomen? I put a knife on the kitchen counter and forgot it was there. Then I walked into it. Me? Have you had anything to eat or drink today prior to your surgery? Patient. No. With a half-eaten candy bar in front of them. Me. Are you sure? Because if you have, you could vomit upon going to sleep, and it could enter your lungs, causing you to die. Patient. Then yes, I have. I had half that candy bar. This one guy repeatedly used to come in saying he hadn't shit in 7 days. This would usually necessitate a rectal examination with a finger. That's why he kept saying it. Patient used to come in every time the new doctors rotated in who wouldn't be wise to his tricks. One guy came in feigning unconsciousness. Did not respond to even the most painful of stimuli. Some of these were pretty painful. Did not budge. We were talking amongst ourselves about intubating him. He then opened his eyes and said, they did that last time. I didn't like it. I've totally had the knife to abdomen guy. Mine said that he was angry and threw the knife he was holding onto the counter, where it then bounced back and stabbed him in the abdomen. 3 times. The others I get, but to 5. What was his endgame? I have no idea. I saw the same guy at another hospital in the same city, pulling the same stunt. As soon as I said to him, "I remember you from X hospital," he opened his eyes, got up and walked out without saying a word. This makes me curious. On a scale of 1 to 10, how bad of an idea would it be to make the patient vomit, then proceed with the surgery? Bad. Best to reschedule for another day if it's an elective procedure. If it's emergency surgery, we accept that they may have a full stomach and proceed, knowing that the surgery is an emergency. But we modify the way we put them to sleep. My favorite assailant was some guy. I was just walking down the street when some guy stabbed me. Or some guy shot me when I was getting gas. Be careful, everyone. Some guy is out there. He's dangerous and will fuck your shit up. My dad neglected to mention he had no teeth. Since 1976. We found out in the IQ. In 2022. Wait, did he wear dentures, or did you just not notice that he didn't have any teeth? Maybe he had a comically large moustache. He does, but also just dentures. Medical school student. Not a big deal, but a patient lied to me about what she had eaten. She was obviously having some problem with her gallbladder. Typically, this pain can be caused by greasy food. So I asked the patient what she had eaten before she got this pain. Patient said she only ate a salad with very little ranch. That's it. I even explained how greasy food can cause this pain, but she's adamant she only ate a salad. Anyways, I report back to my attending and we see her together. The attending asked her what she ate. The patient said salad, then adds she also ate a burger. It wouldn't have changed the plan, but why lie? Not considering the psychiatric and the boring answers, like people who just swear with all their heart that they are taking their medications when they clearly aren't, which is the vast majority. There's not much really. Only one really unique comes to mind. It was a patient that was a really kind old man who always would talk a lot with us, telling stories, praising the beauty of everyone in a tender and respectable way, saying how really grateful for our work he was, and so on. Said old man would always appear with really high blood pressure values, even though he would swear that he always used his medication correctly. And after we did so many changes with his medication in many different ways, it's only natural to think that there's some problem with how he's tackling them, if he was doing it at all. However, one day, after noticing that he would always go to the bathroom before even reaching out to the receptionist, someone discovered he would always eat a load of pure salt before being seen by any of the doctors, trying to make his pressure intentionally go sky high. Later, we also obviously discovered that he indeed would not take his medications correctly as well in order to obtain this result again and again. Turns out he suffered a lot from loneliness, and he was an old man that didn't have much contact with his family anymore, but mostly because his family didn't reach out to him almost at any given time, even though everyone lived close by. And in his desperation, sustaining dangerous high blood pressure was the best way that he had to obtain human contact within the emergency every week. This was the most odd one, but it's really common in general among elderly patients to appear lying about their symptoms, only trying to gather some attention and a private minute to speak about anything else. Most of the time, they book an appointment only to talk about recent trivialities, which makes them clearly better. Although by the end of the talk, it's also easy to see how they gather back part of the sadness that the loneliness bring to them. Around my patients at least, it's common for many to cry as they leave. Loneliness is a hell of both a simple and complex problem, and one that no one should be bound to live with. This one has broken my heart, that poor old man. This is something police deal with a lot where I live as well, not the USA. They'll call them about all kinds of things because they know if they do, someone will come and talk to them, listen to what they have to say. It's really sad they don't have anyone else. Where I live, when an old person begins calling the police, a lot, she gets assigned to a friendship program. Once a month, an officer on duty will visit for an hour or so and can also be called for some household help. Fuck well, that's just about the saddest thing I've read all day. A 13-year girl that went to the to have a baby and said she didn't knew she was pregnant and that she didn't have sex. Mom was wondering why she was always wearing hoodies. I was like, oh then, keep your secrets, and informed authorities to investigate. Apparently the girl had a boyfriend her age and they just were really horny. She came back another 2 times to deliver babies at 17 and 20. 1 year old. Same dad apparently working his ass off. She then opted to ligation. Eventually became a nurse. Dad is a physician and has a million funny stories. He told me this one from a few decades ago. Had a patient come into the with a towel over his groin, covered in blood, claimed he was cutting vegetables in his kitchen and the knife slipped. Dad takes a look and the guy is butchered down there. Had to call a urologist in the middle of the night to consult. Guy eventually confesses to trying to give himself a circumcision because he didn't want to pay the $200 it would have cost. Urologist was able to help save him, but it cost a hell of a lot more than $200 for emergency penis surgery. Emergency penis surgery. Why does this sound so funny, love? Honestly, the dumbest lies are the one people who lie about how much alcohol or other drugs they use. Alcohol and benzodiazepine withdrawal can kill you, and if you use opioids from the street, then you likely have a higher tolerance and may need more medications in the hospital. So be honest. I truly don't care how much you drink use. I just don't want you to get worse for something we can plan for and prevent. My mile was taking 14 off oxymorphone every 8 hours and 5 megofentanyl twice daily, prescribed. She weighed right around 100 pounds. She had surgery and was screaming in pain as soon as the anesthesia wore off. Nurse was absolutely perplexed as they gave her a full shot of Demerol. I told her to check her maintenance doses of daily meds. She went, "Oh shit," and grabbed the anesthesiologist because she legally couldn't medicate her further. Her entire time in the hospital, after having a good chunk of her liver, lung and esophagus removed, was hell for her between the surgical pain and the withdrawal. I used to be an addict, clean almost 8 years. I had surgery for a hernia and disclosed my former habit to the doctor. They ended up having to give me 3 full doses of whatever a normal person would get one of, but they said that because of the knowledge of my prior history, they were prepared for that to be a possibility. Out of curiosity, is there ever a concern of relapse for a former addict if they have to be given anesthetic? It's definitely a concern. I know former heroin addicts that have had surgery and insisted on minimal to no pain medication. My drug of choice was meth. I am living unmedicated. Without obesity, I'm scared to take the stimulants I prescribe. If you've looked into it, but I'm on Strattera, which is a non-stimulant for a day. I can't say how it works combined with a past addiction, but I wanted to let you know it exists, in case you weren't aware. My dad was in the IQ, and I talked to his doc, who said he was agitated and fighting the vent, despite the meds. I said, "How much morphine do you give?" "5 man. Look at his home meds. He's on 30 of morphine for neuropathy." Oh. It's still a low dose, but 5/30 of home oral morphine is at maybe well. I had patients that truly thought they drank 3 beers a day. I had to explain that the standard drink we're referring to is 12 hours of regular beer. They'd be drinking the tall boys, 24, 30 hours of ice beer, other one, 2% of on top. You had to learn to ask follow-ups, or at least define terms. Had a patient tell me they don't drink because they were a recovering alcoholic. A little further prodding and turns out the patient eats bowls of rum, soaked raisins because it's eating and not drinking, so it doesn't count. Would literally empty a bottle of rum into a bowl full of raisins, let it soak for a bit, and snack on those throughout the day. All day, every day. That reminds me of my father telling all and sundry that he quit drinking beer and leaving out the part where he switched to hard liquor instead. "Peter, what are you doing? Crack. What the fuck? Well, at least I'm not drinking, Brian." My uncle used to sit in his truck and drink a 6-pack for lunch, but it didn't count as drinking on the job because he was in the parking lot, not inside the building. This sounds like something Mr. Leahy would done. I've given up drinking, Randers. Just a little snacky. Poo. My father told the nurses that he liked to drink. When I told the nurses that he drank a liter of scotch a day, they said that it made sense and adjusted his medication accordingly. I had the opposite lol. I said I drink socially, meaning rarely, since I rarely socialize at bars. The doctor was like, "So, a lot?" My reply is usually, I buy a 12-pack of beer when spring turns to summer, and I finish it around Halloween. I've just started answering no, since they don't have a charting option for less than once a week. I think a lot of people don't trust doctor-patient privilege, especially with the modern state of insurance companies in the USA. The last thing I want is to tell a doctor that I used an illegal drug and then have that follow me around in some database the rest of my life. I'm just a med student, but a doctor shared this with us. She's a gynecologist, and this woman came to her complaining about how she hasn't gotten her periods in few months. And well, she was showing menopausal symptoms, and in fact she looked almost 50, but she kept saying she's only 30 and she can't have menopause. It has a funny ending when the doctor asked if the woman had a kid, and she said yes, he's 27. Why people lie about their age. But this was a funny story for the whole class. Patient clearly in her early to mid-40s in an urgent care setting. How old are you? I'm 18. Who is this girl sitting next to you? My daughter. How old is she? 14. How old are you? 18. I proceed to stare at her for the next 10 seconds, looking dumbfounded. Sort of the opposite, but I have an ankle that I've sprained quite badly twice. After years of peaked, I managed to rehab it back to full strength, but I never recovered full range of motion. It's close. Years later, I was playing football in the snow with a bunch of teenagers. One of them tackled me, and it went the other way, opposite of the prior sprains, and broke. I hobbled back to the cabin and went to the ER the next day. They referred me to a specialist a week later. I gave this guy dates and times for the previous injuries and the one I had at the time. I was as specific as possible, and he went all Dr. House on me, told me he didn't have time to be lied to, and stormed out. It was fucking weird. I got in to see another specialist, gave him my history. He helped me build it back, and after another year of peaked, it's as strong as it ever was, still about 90% range of motion. I never understood why that first doc was so sure I was lying. I imagine it was because of the build-up of scar tissue and bone. Even now, it's visibly larger than my other ankle. A guy got shot and came into Outrauma Bay Drunkai around Tuam with something like $5,000 in cash, and he told everyone he was on his way to donate it to a drop box at a local charity. Their age. Had a woman say she's 30 when she clearly didn't look it. Oh well, I move on to other questions. Look at her files, and lab reports have her real age on them. 41. Like I though, what difference does it make lying to healthcare staff? This is health-related, not a Tinder profile. Nobody gon' see this and go, I ain't dating an old lady. W, she was married with children? Haha, my mom lies about my age to make herself seem younger. She tells people I'm 25. I am in fact 29. My older sister lies about her age. According to her, she is now my younger sister. When I was 30, I told people I was 40, just because they would tell me how great I looked. If you're gonna lie about your age, go up. I have a friend who says she's 10 years older when she's feeling down. Is usually met with a, you look great, and all is better. Sexual history. Teenage girl came in for lower abdominal pain. We did the usual history and physical examination. She adamantly denied sexual contact, history of vaginal discharge, and refused pelvic examination. She looked like she was in severe pain, so a decision to operate was made. As she was being wheeled off to the operating room, she finally admitted to sexual contact and consented to pelvic exam, where we found a silicone cock ring with spike. She had a pelvic infection and did not need a surgery, just some antibiotics. We're not asking questions to be nosy, we're asking because it's relevant. My girlfriend was in a mood with me, and I thought I'd cheer her up by juggling knives, and then I accidentally stabbed myself in the thigh, said by 19-year-old patient. Not a single person in a believed this nonsense. 30-year-old, definitely not true. 19-year-old, I did some dumb shit to impress girls. Oddly, I believe this could be true. Me too. Some injuries just scream theater kid. My wife is an option. Ma'am, do you currently have something in your vagina?
No, I don't think so. Pulls out vibrator well. I just found this.
Oh my God, I've been looking for that.